most staunch supporters of racial equality can have stereotypes and prejudices and not even know that they're there.
Yeah, several studies show implicit bias can have deadly consequences in the healthcare industry. That's why SSM health professionals are learning how to recognize it. Brady Mallory shows us why the system is taking this action to help better care for patients of color. Brady?
Well, a 2019 report to the Dane County Health Council found babies born to black mothers are twice as likely to have low birth weights. Well, that puts increased risk on several health and developmental stages. Well, researchers found that the birth outcomes were influenced in part by institutional racism and bias. Leaders at SSM Health, St. Mary's Hospital, Madison, are tackling the issue and want to close the gap in health disparities. One way it's doing that is through training for employees, particularly the doctors and nurses who care for women and children. Robbie Sonnentag with SSM Health St. Mary's says studies show black women have 5 times the chances of poor birth outcomes than white women. She says this training is to make sure everyone gets the care they need.
As healthcare professionals, we want to provide great care to everyone. There is not malice intent, yet there is implicit bias that we all have. And the education that we've brought to St. Mary's staff is to make sure folks are aware of that.
Sonnentag says this is through JLA Architects and March of Dimes, and it's just the first step. This particular training is thus far open until late April. So what do employees think about it? We're talking with a nurse about her experience with the training, and we will bring you her answer on News 3 Now at 5.